Hey everyone, welcome back to the Legal Hour podcast. I'm your host for today, Michael Gallion. We're coming to you live from the Legal Cafe in downtown Fort Worth. Also is an office for Bailey and Gallion Attorneys at Law. And I'm here today with Dr. Mark Williams. Doctor.
Hello.
Good to have you on.
Thank you. Nice to be here.
So let's just jump right into it, Doctor.
Okay.
What type of work do you do?
So I'm a chiropractor. I've been in practice 30 years here in Fort Worth. Been in Fort Worth since 1998. I've got a big office, 10,000 square feet. I've got two other associate chiropractors that work with me. I've got a nurse practitioner also that works with me. I've got a licensed psychological counselor as well. I've got a physical therapist and an occupational therapist. So we've got a big clinic.
Oh, wow. So what type of patients are y'all mostly seeing these days?
Well, it's called Texas Injury Clinic, and we primarily treat injuries. We've treated over the years pretty much any kind of injury, on-the-job injuries, sports injuries, hurt yourself working in the yard. But primarily we treat motor vehicle accident injuries, and those are by far the most common. But we treat all kinds of injuries. So.
And I will say I did. Maybe 5, 6, I don't know, probably more, 7 or 8 years ago. I had a sports injury and you all helped me out with some x-rays because I thought I'd messed up my knee. Turns out I was just being a little bit of a baby and it was all fine. But
hey, it's better to be sure.
Yeah, exactly.
Better to be sure.
So you mentioned a lot of the patients you're seeing are related to work injuries, car accidents, things of that nature, and that's kind of where our worlds collide a bit.
Right.
Being as though, I do mostly personal injury, I mostly work injury on my part, but handle a fair bit of car accidents, commercial, and just normal motor vehicle. If you could walk us through, generally, somebody gets in an accident, they come and see you, what that process looks like for somebody who either may have just been in an accident, they don't know what to do, where to go, or somebody just generally wanting to be educated on the topic.
Well, it's important to find a doctor that is familiar with injuries because many people go to a chiropractor, but it's a facility maybe like the Joint where they go in and they're really more of a maintenance care facility. And when you get injuries, it's completely different. You need a thorough evaluation of those injuries, and you have to know how to document those injuries for people like yourselves, the attorneys, because we're asking someone else to pay for it. If the person's coming in and paying cash for that adjustment, then the documentation isn't as crucial. But so when they come in to us, we want to see that person as soon as possible too, because the early stages of an injury are the most crucial time to get that treatment. Mm-hmm. So we're going to do a thorough examination. We're going to take a thorough history. We're going to take x-rays of the injured areas, and we're going to evaluate that person to see what the best way of treatment is to go. So some of those people have seen ER doctor, some haven't. We may be the first person to see them, and that's fine. If they've already had x-rays or CT scans done at the hospital, we'll get copies of those. But then we'll develop a treatment program, a conservative treatment program to start with that involves spinal manipulations. It's going to involve electric stimulation for the muscles. It's going to involve hot packs, cold packs, all the conservative type of treatments that are non-invasive. But then we're going to send them to a medical specialist to get evaluated for medication management as well. So our nurse practitioner, or we'll use an outside facility.
That makes sense. So, for example, specifically when related to a motor vehicle accident or a truck accident, anything like that, what are some of the most common types of injuries you see that for patients that are coming in the door?
So whiplash by far is the most common with motor vehicle collisions, but those can happen in sports injuries as well. Sure. It can happen in a fall. So whiplash is really an acceleration-deceleration injury. That's the technical terminology. And so when we're traveling in a vehicle we're going the same speed as the vehicle. Whatever that speed is, it might be high level of speed, it might be low, but there's a violent, sudden deceleration, and that impact throws our body forward and backward. It takes those joints in our neck, it could be holding onto the wheel, and takes our shoulder joint past its normal range of motion and stretches and sometimes creates little tearing in the ligaments, tendons, muscles, in those joints. It takes them beyond their normal range of motion, and it can be as small as a fraying injury, like a sprain or strain, or could be a more severe tear, and that can be a more permanent injury and
Sure.
take much more treatment to heal it.
Yet I also find, you mentioned the sudden acceleration, deceleration type injuries. In my experience with clients that suffer maybe traumatic brain injury, you almost see that sometimes as well, that just because you don't hit your head doesn't mean you can't have a concussion. Sometimes that sudden acceleration, deceleration causes that brain to rattle around inside the skull.
Yeah, so the brain is soft and it's encased in the hard skull. So we all know if we sprain our ankle, we take that ankle beyond its normal range of motion, it blows up. We see that swelling, we see the black and blue. But with our skull, the brain hits that skull, creates inflammation, but the inflammation has nowhere to go except press inwardly. Mm-hmm. So that causes headache, and it can cause a whole series of symptoms. Nausea, vomiting, ears ringing, blurred vision, loss of memory, difficult time concentrating, difficult time staying focused, problems with sleep. It's a whole myriad of problems, and it's really much more common than most people think. And we've become more educated over the years. I've been doing this 30 years, and initially in my practice, or way back 30 years ago, it was much more misdiagnosed or undiagnosed.
Right.
We've gotten much better at it, and so we refer patients to a neurologist for evaluation and treatment. So that has gotten a lot better over the 30 years.
I was going to mention that it seems as though just the science related to concussion type injuries has changed a lot, and a lot of it having to do with professional sports like the NFL.
Yes.
There was recently that concussion movie.
Yes.
And other things that people don't realize. So many people play sports in high school, whatever it may be, football, and it used to almost be, jokingly that, I got a concussion or I blacked out for a minute, and it wasn't necessarily taken as seriously. But
yes, that has helped our profession as well. Just the awareness and the education and the research that they've done related to football and the movies, it's just created much better awareness and much better understanding and much better treatment too. And really for the most part, the most important thing for most athletes or people in general is just to shut things down, get off the field and make sure that you don't have more head trauma on top of that old head trauma. And there's a sad story about a young boy whose father was the coach of the football team, high school football team, and the kid was the star running back, and he got in a football collision, got a concussion, was off the field for a short period of time. The coach said, "Hey, are you good?" Asking the kid, who has no clue if he's good or not. They didn't have the professional on the sidelines evaluating that poor kid. The kid wanted to get back in the game. He goes back in the game, goes up for a ball, lands on his head, and that poor kid was now unable to feed himself or do anything. So those kind of severe things, severe injuries, have woken us all up and make sure that we're much more careful about things now.
Right, and I guess that kind of leads to this next question about not necessarily only concussions, but whiplash injuries and other maybe even just soft tissue injuries don't always aren't always noticeable right away, right?
It's true. So when we are in a car accident, we have a natural process. It's the fight or flight. They call it the stress response, fight or flight response, and natural endorphins and natural adrenaline is released to help us through that situation. It's been around since the beginning of time, and it helps us survive a stressful situation that could be a life or death situation. And so we often don't know if we're hurt or not. We can't feel the pain, and that's our main warning sign to know if there's a problem. And so when we have those natural painkillers and adrenaline flowing, we're just been in a car wreck, overload of information to our brain, and we're trying to figure out our car and who's hurt and is the car going to blow up and what do I need to do, and most people don't. You're overwhelmed. But so you're not really thinking about, well, do I have a sprained neck or do I have a concussion? You're just trying to get through this stressful situation. So a lot of people don't know if I should go to a hospital or should I go to see my doctor until a day or two later. Then everything wears off, and then they start to feel it, and then they start to try to figure out, where do I go and what do I do? And unfortunately, the place that most people go to first is their family doctor. Unfortunately, family doctors are not musculoskeletal experts. They're experts in systemic diseases and sniffles and sneezes and flu and COVID and all those things, and they're great at that. But when it comes to musculoskeletal injuries, that's not their expertise. So unfortunately, sometimes they give them bad information and say, oh, it's just going to heal itself in 4 to 6 weeks. That's bad information. We need treatment. The other side is they may say, well, sorry, we don't treat that kind of thing. I'm sorry, you're going to have to find someone else.
Right.
So then the patient doesn't know what to do at that point. They don't know, should I just leave it, or they start searching, and sometimes it takes them weeks, or longer to find someone to treat them.
Right, and I guess that becomes an issue to a certain extent, and I can talk about from my side of things after, but from a recovery standpoint, a few weeks passing by without getting any sort of treatment at all can be problematic for somebody trying to recover from those sorts of injuries, right?
It is. That initial time frame is the best time to get treatment. We want to treat that patient initially as soon as possible. That's when we can turn the things around. We can get the healing processes started the right way, administer the treatment that is going to help this rapidly heal, and avoid prolonged, drawn-out treatment.
Right. And so on the flip side, or on my side of things, you mentioned all of the ways that most people run into these issues. They go to their primary care physician, they maybe go to a corner ER of some sort, and maybe they get checked out for very acute injuries. They say nothing's broken, you're fine,
right.
And then eventually you try and make some sort of claim from the insurance company because you have a lot of medical that comes down the line once you actually start feeling, hey, I'm not able to sleep at night. Hey, my back is really killing me. And unfortunately, the insurance company says, why'd you wait 2, 3, 4, 5 weeks? You must have not been that hurt. We're going to minimize or diminish your claim because you clearly weren't that hurt. And I feel like not only are you hurting your recovery process by not addressing it, but you're potentially hurting the claim that you may have to, get yourself just back to the place that you wanted to be prior to getting into that accident.
Well, many people have never been in a car accident before, and they don't know what the process is. They don't know how an insurance company thinks about things. They're hurting, but everyone hopes they're not injured. Mm-hmm. Everyone hopes that it's going to get better on its own.
Exactly.
Nobody has the time, well, most people don't have the time to go seek out doctor visits and which one is the right one to go to, and they just don't know where to go, and it's confusing, it's frustrating, and they're worried about their car, and they hope it goes away, and they really are hurting their recovery process when during that time period that's taking them weeks or longer to find someone to go to.
Yeah, and you mentioned, I mean, not only you're worried about getting your car fixed, you're worried about getting the medical and how much all these things are going to cost. And so I will shamelessly plug our law firm, Bailey & Gallion. If you're in that scenario, you know, we're here, we're ready to help you out, and we'll, if you don't know which doctors to go to, then we'll definitely connect you with great doctors like Dr. Williams and his facility. But anyway, moving on. What should a patient expect? We kind of touched on it from a high level at the beginning of this, but they're in some sort of accident, whether it be a slip and fall, a work accident, a car accident, and they come to your facility. What should they have in mind coming in, what they're going to get?
Well, so again, we're going to do a thorough history of how the accident happened. We're going to do a thorough examination of each of the body parts. And sometimes people are hurting so much in one area or two areas that they tend to forget or not even realize that other areas are actually injured. So we know that, and so we're going to check everywhere, at least the most, especially when we look at the mechanism of injury. We're going to look at those areas: the knees, the shoulders, the wrists, elbows. We're going to go through the neck and the back and make sure that any of those areas are not injured, even if they are not aware of it. So, and then we're going to take those areas that we're most concerned about. We're going to shoot x-rays. If they don't have any x-rays, we're going to shoot x-rays, and we're going to develop a conservative treatment program, and then we'll refer them over to the nurse practitioner or an MD for medication management.
And I think you mentioned conservative care. First, what is it? And second, why is it important to start with conservative care with these patients?
Well, we don't want to, there's over the years they've developed, it's step A, step B, C, D. We don't want to jump from A to E. We want to take the least expensive and least invasive treatment first and see if that helps and see how that goes. And those are physical therapy modalities that have been around forever. We do have some more cutting edge, newer type of therapies. One is photobiomodulation. It's also called laser. A lot of people aren't familiar with it, but it is a newer therapy, and it's actually light therapy. It's photon light that is absorbed through the body, through the skin, and it goes into the cellular level, into the mitochondria, and stimulates mitochondria to produce more ATP, which is the energy packet of our cells, to produce more ATP, and that produces faster healing time. So we expect about a 50% reduction in healing time of areas that are injured, but not. You can't have it can't fix a full tear in a shoulder, but
right.
But smaller tears or smaller sprains and strains, it heals those much faster.
And you mentioned A to D. So somebody walking in, you're not going to immediately say, all right, we're going to send you into surgery, right?
Right. No.
You want to make sure that
no.
If we can do it through physical therapy or something like that.
Right. We always want to start with that first, and hopefully avoid surgery. Most people want to avoid surgery.
Right. Exactly.
And we save the big guns for later. Injections and all that. So typically after 3 to 4 weeks of treatment, and we're checking with the patient. We're doing spinal manipulations, and we're checking to see the progress, and the areas that may not be progressing well, we'll focus on those a little more. But after 3 or 4 weeks, we do a full reevaluation, and the areas that are not progressing well and that are still giving the patient the most difficulty, and we still have positive findings on exams, those are the areas that we want to get the MRIs.
Right.
Hopefully, some people don't need them. Others do. Sometimes it's one, sometimes it's two, or maybe three. So we'll order those MRIs, and based upon those findings, we'll refer out to the proper specialist. It might be an orthopedic surgeon, it might be a pain management specialist. So we'll refer out to them, and then they do their evaluation, send us back their report, and then we can go over with the patient what those findings really mean, and explain it in a little bit different way or a little bit different detail than maybe that specialist gave it to them. So it's confusing for a lot of patients, and
Right.
we try and walk them through that. We try and help them, understand what they're recommending.
So for those who don't know, what is the difference between an X-ray and an MRI?
So really with X-rays, we're looking for fractures, obviously, so we can see bone, and we can see the space between the bones. So in our spine, we have vertebrae, and then we have discs in between, and so we can see alignment of the vertebrae, and we can see the spacing of the disc if it's shrunk, but we can't tell really much about the disc, the soft tissue, or in a meniscus in the knee, the cartilage, or the ligaments. We can't see those soft tissue structures, the ligaments, tendons, the cartilage. But in an MRI, those soft tissue structures are really what we're looking for. And that those more severe injuries are best imaged in an MRI.
Right. So I guess, if your bone is fractured, it's pretty easily seen on the X-ray, but when we're talking about, like you mentioned, a meniscus or potentially a disc herniation of some sort or something like that, the MRI kind of gets you more to a closer level.
Correct.
Okay.
Yes, that's what we need that for. And then based upon those findings, we send out to the specialist, and we do have treatment for an injured disc as well. I was saying some more cutting edge type therapies. We've got a spinal decompression machine, the DRX 9000, which is a non-invasive, non-surgical treatment for disc injuries. And it's been very, very successful. And they've done before and after MRI studies. And we've had phenomenal success, and the pre and post MRIs show it. But if we give the option to the patient to see the pain management, they're going to offer injections. An orthopedic surgeon can offer a surgery, and we can offer spinal decompression therapy. So it's really up to the patient to decide which is the best treatment for them.
Right. And you talked about earlier, this original course of treatment being the 3 to 4 weeks. Talk about how the consistency of the treatment is, if at all, crucial in that recovery.
So consistency of treatment is important, because I liken it to a diet or an exercise program. Everybody knows the more consistent you are with your diet or your exercise program, the better results you're going to get. It's the same thing with our bodies treating it after an injury. We need consistent care 3 days a week normally to get the best results, the most rapid recovery, and the best repair, tissue regeneration with those injuries.
And I will say, from my side of things as well, when it comes time to make a claim, if there was a negligent party that caused your accident, that consistency in treatment will seriously help those claims, because otherwise you may have some defense attorney or some insurance adjuster or somebody out there saying, well, you missed 20% of your treatments that the doctor actually originally prescribed, and so you must not have been hurting that bad. But in your experience, are you seeing people missing appointments because they're not actually hurt, or does life sometimes gets in the way?
No, life gets in the way. I mean, there's never a great time to have to go see the doctor for an hour 3 days a week,
right,
or go get MRIs on top of that, or go see the pain management or the orthopedic. Everybody's busy. Life is hectic. We've got kids and work and everything else. So yeah, it's never convenient, and so it is difficult for some people to make all their appointments, and but the people that do get better results. But no, it's mostly, it's not because they're hurting, and they come back in and tell me, yeah, in fact, it's gotten worse since I missed last week. Now I actually feel worse, and that just strengthens my argument of why they need to get in. But no, it's generally because their life just gets in the way, or they get sick, or who knows.
Right, and you mentioned better results, but not only better results from a treatment perspective, but better results from
On your end?
on eventually the claim you're going to make. So I would say it's important. But so a lot of people, after they're involved in an incident, not only have issues with dealing with everything else they're dealing with in life, but they can't get to the doctor because their car is still totaled. The insurance company hasn't dealt with it. Are there certain things that y'all try and do to make patients' lives easier?
Well, yeah, if their car is been totaled, or they haven't had time to get their car repaired yet, or they only have one vehicle in their family, or some people really can't drive because they've injured their ankle and they have a boot on, or they've injured their shoulder and they're in a sling and it's not safe for them to drive. We pick those patients up. We have a van and a driver, and if that somehow isn't working, we can always send an Uber for them too. So we try to help people out as best we can.
Yeah, and because like we've discussed, the consistency in treatment can be so helpful for somebody's recovery.
Oh yeah, it's so important.
You want to minimize I wouldn't say excuses, but reasons as to why people can't make it, because it's crucial.
And we're open till 6 p.m., so we try to stay open later. Most people are off by 4 or 5 o'clock.
Oh yeah.
And so we stay open till 6 p.m. So we're there after, a little bit later than many businesses.
Right. I mean, I'd say probably most doctors' offices, they try and sneak out before 5 most days. So you have no excuses. If you need to get treatment, reach out to Dr. Williams and his facility. They'll get you fixed up. But so, doctor, I guess the last thing I would say is we've touched on a lot today. But are there any general pieces of advice or tidbits or things we may not have talked about that, if somebody's been in an accident, whether it be work, car, truck, slip and fall, any of these things that you want to leave people with before we call it for today?
Well, I just think that pain is our body's natural warning sign. It doesn't tell us what's wrong, but it tells us something is wrong. Find a doctor that is skilled and experienced in treating injuries and evaluating injuries, and that has the network of good referral doctors and facilities that they can refer you to get the right evaluations and the right treatment that you need, and get evaluated as soon as possible. Don't wait to see if it's going to go away on its own. You're always better off to be safe than sorry, and that first week is crucial. Get in as soon as possible. See a doctor, or find an attorney like yourself that knows good doctors. So we may not be convenient, but your facility, your law firm is going to know of a good doctor in their location. So that's crucial.
Doctor, a lot of times us attorneys, whether it be from an insurance adjuster or maybe even in the courtroom, when defense attorneys are trying to argue that your patient or our client isn't really all that hurt, they'll say, well, it was just some soft tissue injuries that they sustained. What's your response to that?
Frankly, I think it's a ridiculous argument, because everything in the body other than a bone injury is a soft tissue injury. And frankly, a broken bone will heal up perfectly. You will never know you had a broken bone. I've fractured both bones in this leg skiing. I never know that it was ever broken. It never nags me. But if you think about, where do people have nagging injuries? So it's the nagging back, the nagging neck, the nagging shoulder, the nagging knee. It could be an old football injury, an old military injury, an old car wreck. Those injuries nag people for years, 5, 10, 20, maybe the rest of their life. Those are the areas that become chronic pain areas. Why is that? Well, if you think about it, skin, muscle, and bone all have really good blood supply to them. So skin, if you get a bad cut on your skin, a couple weeks down the road, 2, 3, 4 weeks down the road, that bad cut is healed up and that never nags you again. Muscle, same thing. You pull a muscle and 2, 3 weeks, maybe a month or two, that muscle is, unless it's a bad tear,
Right.
that muscle, pulled muscle, will heal up and it doesn't nag you again. Same thing with a bone injury. Like we said, you break a bone, it'll heal up, doesn't nag you. The nagging injuries are in joints, back, neck, shoulder, knee. Those areas, what's different? Ligaments, tendons, and cartilage. Those do not have good blood supply to them, and they do not heal well on their own. We need to force blood flow, which are the building blocks, the nutrients that repair. We have to force blood flow in there, or photobiomodulation, the laser, to speed recovery and help tissue repair. One of the things that the pain management guys are doing now is PRP, platelet-rich plasma.
Right.
They're injecting that, and that helps. It's similar to stem cells, and that's helping regrow tissue. So those areas are the ones that will cause people chronic pain for years, and then can be what they call permanent injuries. And so those are the areas that are much more severe than a broken bone. I'd much rather have a broken bone than to have a severe disc injury that's pressing on a nerve. And now I'm looking at either spinal decompression or steroid injections or surgery.
Yeah, that's a very fair point. Along those same lines of misconceptions, what are the common misconceptions you hear about when it comes to chiropractic care?
Well, that all we're doing is a spinal manipulation.
Right.
So we do spinal manipulations, but that's one of the tools in our toolbox. So people are familiar with facilities like the Joint, where you don't need an appointment, you can show up anytime, get an adjustment, and you're in and out in 10 minutes. And that's great, and that serves a purpose. But what we do, we manage this person's case and their injury. We're kind of like the quarterback with these cases, where we help the patient understand their injuries, we send them to the referrals, we help them understand what the referrals want to do and what they're recommending, and we have many more treatments. We utilize physical therapy, occupational therapy, psychological counseling, and we utilize all the different photobiomodulation and spinal decompressions. So just chiropractic is technically someone saying, well, you're just giving someone a spinal manipulation, which has a value and it's good, but it's only one tool in the toolbox.
Right. So the level of care and the difference of care that y'all are providing is obviously not just the spinal decompression, it's all those things that you discussed.
Right.
Now, doctor, is there anything that we haven't yet touched on today that you'd say is important? Because as you mentioned, so many people haven't necessarily suffered one of these soft tissue injuries, whether it be a car wreck, whether it be a sport injury, whether they're just gardening in the yard and all of a sudden they tear something. What should they know once that happens? And hopefully it doesn't happen to them, but what's the next step?
Well, if they get in an injury, a car wreck or work injury, most times they're not going to know how to navigate this. And yeah, I can help them through it, but they need a good legal representation. And Bailey and Gallion has been a great addition to our team, so to speak, because you help them not have to worry about their car or their legal side of things. You can help them on that side to deal with the insurance companies, which can be very difficult for someone to try and navigate through adjusters and all of that on their own. So they do need to find a good attorney. And a lot of times they don't know who's good and who isn't, so we can help them find a good attorney like yourself, and if they come to you first, you help them find a good doctor. So those two things are crucial in getting the proper care and then having a successful settlement or settlement at the end of their case.
Right. That's a very fair point. Finding people who are experienced, whether it be on the medical or the legal side, is very important, because as we discussed earlier, there's a lot of people that may just go to their PCP or go to a physician that doesn't necessarily specialize, thank you, in work injuries or car accidents or anything like that, that doesn't know where to send them or what type of care to do. So y'all are doing important work out there, and we really appreciate it. Well, everyone, that's been another episode of The Legal Hour here with Dr. Mark Williams from the Texas Injury Clinic. We are at the Legal Cafe in downtown Fort Worth. If you or a loved one have been in any sort of car accident, workplace injury, premise accident, a slip and fall, please either give Bailey and Gallion a call, give Dr. Mark Williams a call. We'll make sure that you get fixed up and get the best care that you can. Doctor, thanks for your time.
Oh, thank you.